Saindou Ben Ali Mbaé, and who is with the Ministry of Health on the Comoros and working with the Indian Ocean FETP. Is that the way to refer to it? The presentation will be on food poisoning outbreak and fatality following ingestion of sea turtle meat in the rural community of Ndrondroni, Mohéli Island, Comoros in December 2012, I guess.
Ladies and gentlemen, good afternoon. It is a pleasure to be here today and present this outbreak investigation. I would like to thank the organizer and EIN for making my participation to this conference possible. I'm from Comoros, an island territory situated to the northwest of Madagascar, in the Indian Ocean. It has a population of 700,000 people. On 24 December 2012, an article was published in a national newspaper reporting several hospitalizations and deaths in Ndrondroni village. It also reported sea turtle meat consumption among the local population. This map shows the archipelago of Comoros. Ndrondroni is a village located on the island of Mohéli, 38,000 inhabitants, where there is a protected marine park. Ndrondroni village has a population 3,688. The majority of Ndrondroni inhabitants are fishermen and farmers. The investigation team involves staff from the Ministry of Health, the Health Authority of Mohéli, and the FETB coordinator. Our objectives were to confirm and describe the outbreak in time, person, and place, to identify the vehicle and the source, and to control the outbreak and to make recommendations to prevent future episodes. We started by doing case finding in healthcare facilities in the local dispensaries and hospitals. Once we were able to identify the affected area, we did a door-to-door survey. We defined a probable case as a resident of Ndrondroni with at least two of the following symptoms between 19 December 2012 and 1st January 2030, excluding diagnostics such as malaria and TB. We conducted a case control study in the affected area. We used the probable cases definition. Controls were defined as a resident of Ndrondroni who was symptoms-free from 19 December and 1st January. We randomly selected 2 controllers and each household of the affected area. We used a standardized questionnaire to collect individual demographic and socio-economic data, information on symptoms, on water and food consumption for the week prior to symptom onset for cases, and between 16 December and 1st January for controls. We also collected information on the species and number of animals present in around the houses. We interviewed one of the employees of the marine park. With this data, we built an epidemic curve. We calculated attack rate by age group, and we described the frequency of symptoms. We calculated the odds ratio for each exposure for the case control study. On this slide, you can see the epidemic curve showing the number of probable cases by date of onset. In red, the child aged 6 months who died. In green, the 2 hospitalized cases. The 8 probable cases occurred over a period of 7 days. This table shows the attack rate for the village and for the affected area. The attack rate for Ndrondroni village was 0.22%. In the affected area, the attack rate was 6.4%. Adults as well as children were affected. As you can see from this table, the most frequently reported symptoms were itching, asthenia, vomiting, and abdominal pain. 2 cases reported itching around the mouth. 1 case reported mouth burn, and another one dysphagia. Among the 29 households living in the affected area, 21 were present at the time of the survey and accepted to participate. The others were out working. We include 8 cases and 30 controls. Median age was 25.5 for cases and 20 for controls. This table shows the number and proportion of people that consumed each food item among cases and control. It presents the crude ratio with a 95% confidence interval. The odd ratio for total meat is 19.5, and it is statistically significant. We also observe a dose response. The odd ratio increases with the quantity of sea turtle meat consumed. It is 4.3 for those who consumed between 1 and 5 pieces, compared to 29 for those who consumed more than 5 pieces. The sea turtle was killed on 20 December and was eaten in the affected area from 20 December to 22 December. 2 cases developed symptoms on the day of exposure, 2 on the day following exposure, 1 3 days later. 1 case reported symptoms 5 days after turtle meat consumption. We reported 1 death in a 6-month-old baby girl whose mother had consumed 3 pieces of turtle meat the day before onset. The infant developed malaise and vomiting. She died 2 days later. Marine Park employees found the carcass of Erythromecheilus imbricata situated on the nearby beach. Based on the interviews, the meat was cooked by 2 separated households of this affected area. Inhabitants also reported that dogs were found dead after consuming turtle meat. Our investigation faced several limitations. Killing and eating turtle meat is illegal on Mohéli. There could have been underreporting of cases, as well as underreporting of turtle consumption during the survey. However, the presence of community health workers ensured trust and cooperation. We carried out the investigation 10 days after the outbreak. This could have led to recall bias, which might have overestimated the measure of association. 28% of households were out fishing and farmers during the survey. This could have led to a selection bias. No biological samples were available for testing, and no autopsy was done on the deceased child. Despite this limitation, there is a strong and consistent evidence to suggest causality between the disease and turtle meat consumption. Symptoms and relatively short incubation period are compatible with toxin-related illnesses. The species Erythromecheilus imbricata has been incriminated in previous outbreaks in Micronesia. Marine biologists know the toxicity of Erythromecheilus imbricata, probably due to a toxin present in marine algae part of the turtle diet. This biological plausibility, together with a strong association and a dose response, suggests a causality between turtle meat consumption and the outbreak. The baby girl who died did not directly consume turtle meat, but she was breastfed by her mother, who reported having consumed turtle meat. A similar fatality has been reported in a breastfed child whose mother consumed Erythromechalis imbricata turtle meat in a documented outbreak in Micronesia. We recommended to organize an information campaign in Mohéli, informing the population on the potentially fatal poisoning linking with consumption of the sea turtle locally, now as nyambamal, stressing that cooking does not make the meat any safer, and informing mothers that they can harm their infants when eating sea turtle meat. We also encourage the health professionals from district health centers to timely report unusual health events to the surveillance unit. Finally, we are working with the regional network SEGA to identify regional laboratory capacity to initiate the research on the toxin. I would like to thank the people who participated to this outbreak investigation, and I would like to thank you for your attention.
Thank you very much for this case study on causality. We have everything, right? The strong association, the dose response, the consistency, the biological plausibility, the time preceding exposure. So we have time for questions. Giri?
Thank you. Giri Shankar, Public Health England. I was just wondering, the infant who sadly died, were you aware of any underlying conditions, or was the child previously known to be fit and healthy? As first ones. Along with that, I also want to one of the recommendations about breastfeeding advice to infants. How did you put across this message to the mothers? I'm just thinking, this mother who was symptomatic, and if you say that, she'll probably feel guilty for the rest of her life for having caused the infection in the child. So how did you manage to get the message across?
I'm going to translate a little bit. La première question, c'est l'enfant qui est décédé alors qu'il était nourri au sein. Est-ce qu'il avait une maladie précédemment? Et la deuxième, est-ce qu'il était sain ou est-ce qu'il avait une maladie sous-jacente?
Non.
Et l'autre question, c'est comment vous avez communiqué avec la mère par rapport à éventuellement son sentiment de culpabilité d'avoir causé le décès de l'enfant en ayant consommé la viande de tortue et d'avoir passé la toxine dans le lait maternel.
L'enfant qui est décédé, à notre connaissance, elle n'a pas eu de pathologie adjacente, sous-jacente en quelque sorte. Et vous savez, chez nous au Comores, une famille qui a eu un décès, c'est pas facile d'aborder cette famille. Toujours est-il que puisque j'étais là, j'ai essayé d'utiliser un peu la religion et d'essayer de calmer la maman pour pouvoir lui poser les questions relatives au décès de son enfant. Donc, mais c'était pas facile évidemment puisque elle venait de perdre son enfant, mais j'ai essayé d'utiliser la religion, parce que la religion musulmane chez nous, ce qui faisait que vraiment elle a pu accepter facilement le décès de son fils, de sa fille plutôt, et elle a accepté évidemment de nous confier et de nous expliquer tout ce qui s'est passé.
Okay, so the answer to the first question is, to the knowledge of the investigator, there was no pre-existing illness for the child. And the answer to the second question is that in the environment of the Comoros Island, it's not easy to approach the family of a child who has died, so that the investigators used a culturally appropriate technique, making reference to the religious background, which in that case is Islam, to be able to provide some counseling and comfort to the mother and also conduct the interviews.
Hello, Florian from Germany. I would like to follow up the idea of the algae toxins. When we have them in Europe, it is usually the mussels who filtrate the algae. And the question is, have you, or is it customary also to eat the how do you say, the mussel seafood in this region? Because then you would observe similar cases.
Mussel as in the seafood.
The seafood, yeah, the French seafood thing.
Okay. I thought for more, yeah. Donc, en Europe, il y a des cas un peu équivalents d'intoxication avec la consommation des moules, hein, les coquillages. Donc, est-ce que vous avez aussi aux Comores la consommation des moules? Est-ce que vous avez également le même type d'intoxication après consommation de moules?
À ma connaissance, je ne connais pas. J'ai aucune idée sur ça.
To their knowledge, no.
Merci. Local people know what is good for them, and I suppose if they eat turtle, if it's because they like it and because it's good for them, doesn't make them sick usually. So what is the reason why suddenly we have this problem? Have we had the same problem before, or is it new that they're now eating turtle? And then I'm also curious to know what it tastes like.
So
Je traduirai moi-même si tu veux.
Oui, tu peux traduire toi-même en genevois.
Merci. Je disais, les gens, les locaux savent ce qui est bon pour eux. S'ils mangent des tortues, c'est que c'est bon pour eux, ou en tout cas, ils pensent que c'est bon pour eux. Et j'imagine qu'ils en mangeaient avant et que c'est peut-être pas quelque chose de nouveau. Ou bien c'est quelque chose de nouveau. Mais je serais curieux de savoir quelle est l'habitude alimentaire par rapport aux tortues. Et la deuxième question, je suis curieux de savoir à quoi ça goûte, la tortue. Est-ce que je devrais venir en goûter aux Comores? Est-ce que ça vaut la peine?
Ok, merci pour la question.
Merci.
Moi qui suis là, je n'ai jamais mangé la tortue, étant donné que je suis comorien, mais je n'ai jamais consommé de la tortue. N'empêche qu'il y a beaucoup de Comoriens qui consomment de la tortue. Et puis, comme je l'ai montré, c'est un archipel, il y a 4 îles. Et au niveau de l'île de Mohéli, là où nous avons mené l'investigation, la population de cette île consomme abondamment la viande de tortue. Mais c'est illégal, mais ce n'est pas tabou pour eux. Donc, d'habitude, ils consomment la tortue verte, qui n'est pas réputée toxique, bien que parfois, elle peut être toxique. Mais cette fois-ci, en consommant de la tortue, ils pensaient que c'était le même type de tortue. Et il s'est avéré que c'est un autre type de tortue qui était toxique. Et pour ce qui est de la viande, pour ceux qui ont déjà mangé de la viande de tortue, ils disent que vraiment c'est une viande très douce et vraiment qui a un goût vraiment succulent.
So it seems that the consumption of turtle meat, particularly in this island, is pretty popular, but normally they would eat a different species, which would be a green species, tortue verte, green species, a green turtle. So maybe there's been a confusion on the species involved. And other than that, we're told that the turtle meat apparently is very good to eat, but the green one.
Ouais.
Any other questions?
Hi, Tom White from the UK Field Epidemiology Training Programme. My question was about the theory that this was a marine algal toxin, as Florian mentioned just now. And my understanding is that lots of the marine algal toxin poisonings have a very rapid onset of disease, and in this case it was up to 5 days. So whether you had been able to develop any theories about what the toxin in question was here. And then my second question was whether there had been any evidence of a recent algal bloom, for example, a fish die-off or the so-called red tide that we sometimes see.
Donc normalement, ce genre de toxine conduirait à une durée d'incubation plus courte autour de 5 heures. Donc là, quelques heures. Et dans ce cas présent, il y a eu des cas jusqu'à 5 jours après. Donc est-ce que c'est compatible? Et est-ce qu'éventuellement, il n'y aurait pas eu dans la région des problèmes de red tide, hein, c'est ça? Red tide, is that what you said, Tom? I'm not familiar. Red tide, décès de poissons avec de la vague rouge, ce type de manifestation toxique. Est-ce qu'éventuellement il y aurait eu des problèmes de ce type rapportés dans la région?
Bon, au niveau de la région, au moment de l'investigation, et jusqu'à présent, là où je vous parle, je ne suis même pas au courant de ce type d'événement. Pour ce qui est de la première question, qui était relative à la date d'incubation, si j'ai bien compris, c'est que nous avons l'habitude d'envoyer nos échantillons à l'IPM, Institut Pasteur de Madagascar, pour analyser nos échantillons, quels que soient les types d'échantillons. Il se trouve qu'au niveau de Madagascar, leur laboratoire n'arrive même pas à détecter les toxines. Donc, c'est vrai, bon, c'est pourquoi nous sommes dit que le fait qu'il y a eu 5 jours, hein, la date d'incubation était relativement brève, tout en sachant qu'on n'est pas des experts dans le domaine, on s'est dit qu'il s'agit bien de la toxine. Mais je ne peux pas répondre d'une façon affirmative qu'il s'agit, puisqu'on n'a pas eu, comme je l'ai dit, il n'y a pas eu ni autopsie, ni analyse toxique un peu poussée. Donc je ne peux pas répondre d'une façon affirmative à la question posée.
So as far as the red tide, apparently, to the knowledge of the investigators, there were no such occurrences. In terms of the incubation period, there are some limitations because the usual laboratory that they're using in Madagascar doesn't do that kind of toxicological analysis, and there were no autopsy conducted. So therefore, there's no way that they can formally conclude that this was this kind of toxin. But in the context and to the best of their knowledge of understanding, that's the most likely hypothesis. Thomas, you correct me if you think I've mistranslated or... Maybe take the microphone waste for a second.
Thanks. Just a brief compliment to Saindou's response on the toxin. So it's true we didn't have any samples. We couldn't sample the total, no biological sample from the people. If you look at the literature, there's one toxin called the Lingbia toxin that was already found in turtle meat, in actually green turtle meat. We consume a sponge that is poisonous and contain that toxin. And there's been actually very few documented outbreaks due to sea turtle meat. And the incubation period, you're right, in the other one was shorter. They all had symptoms within 2 days. So most of the people on the same day, which is something that we're still unclear about in this outbreak. Note that Saindou, correct me if I'm wrong. The person who had symptoms 5 days after consuming turtle meat repeatedly consumed turtle meat throughout the week, and it's an outlier, and it probably does not reflect the median incubation period for this outbreak, for this limited outbreak, I should say.
Okay. One more question.
Thank you, Saindou, for your presentation. Merci pour ta présentation. Tu dis que l'origine du signalement, c'était un article dans un journal. Est-ce que dans la Comores, vous regardez systématiquement les journaux pour voir s'il n'y a pas des signalements, des choses qui peuvent vous intéresser? Donc my question is, the origin of the signal is from a newspaper, so do they systematically look to media to identify potential outbreaks?
Merci pour la question intéressante. On n'a pas l'habitude de lire les journaux aux Comores. Nombreux sont les gens qui ne lisent même pas les journaux. Mais il se trouve que pour cette alerte, il y a eu quelqu'un qui était au niveau de Mohéli, qui travaillait au niveau du ministère régional de la santé de Mohéli, et qui s'est donné le courage d'écrire l'alerte au niveau du journal. Et en même temps, puisque nous avons des points focaux au niveau des îles qui s'occupent de la surveillance, on m'a alerté après que j'ai lu sur le journal l'alerte. Le point focal m'a alerté qu'il y a eu un événement inhabituel. Il y a eu des décès, il y a des gens qui ont consommé de la viande de tortue. Mais c'était un peu tard. C'est après que les journaux ont déjà diffusé l'information. Mais d'habitude, les gens ne lisent pas les journaux. L'information circule de bouche à oreille uniquement.
So there's no regular practice of media scanning, and reading newspaper is not very common in the Comoros Island. Most information is passed on from one person to the other. So in that case, there was the alert in the newspaper, and afterwards the focal point in the island notified you at the Ministry of Health level, but that was only after the news had been already printed in the newspaper. Am I correct? Ils vous ont informé après que c'était dans les journaux.
Voilà.
One last question, maybe, so that we move on afterwards.
Yeah, Is it on? Yeah. I was just wondering, since considering the limitations, if there was like a take-home message that you can actually tell us about for a possible reoccurrence of this kind of outbreak. Alors, basiquement, je me demandais s'il y a quelque chose en plus qui pourrait être fait pour la prochaine fois. Parce que il y avait les réponse rate, c'était pas trop. Alors, mais je me demandais si on pourrait faire quelque chose à propos de ça ou chose comme ça. Merci.
Je n'ai pas bien compris sa question.
Are you asking about what could be done to increase the response rate, or?
And other possible, to fight other limitations of the study. To be prepared for the next time, basically.
Okay, so more in terms of the methodological limitations.
Yeah, exactly.
Il y avait quelques limitations dans votre étude au niveau de la proportion de réponses et les autres limitations, par exemple pour le laboratoire, etc. Donc, est-ce que pour la prochaine investigation, vous avez un plan pour essayer d'adresser de manière prospective ce genre de limitations pour faire une meilleure investigation la prochaine fois?
Bon, d'abord, pour la population, il y a eu une franche collaboration. Mais pour ce qui est des laboratoires, comme je l'ai souligné tantôt, nous sommes limités puisqu'on n'a pas de laboratoires performants qui pourront quand même, pour la prochaine fois, pouvoir détecter, analyser de façon idéale les échantillons que nous aurons vraiment à prélever. Donc, ce sont des mesures qui doivent être prises par nos gouvernants, de mettre en place, de prendre toutes les dispositions. Nous avons déjà remis le rapport. Je pense que c'est à eux de prendre les dispositions qui s'en faut. Donc, nous avons émis les recommandations. Mais encore une fois, je pense que le fait d'avoir des laboratoires performants au niveau, que ce soit au niveau des Comores, que ce soit au niveau de la région, ça pourrait toujours nous aider pour des événements futurs de ce genre.
Okay, so in terms of the collaboration of the population, there was a very good collaboration actually, so it doesn't sound like there could be a need for improvement. In terms of the laboratory capacity, it's not something that is in the hands of the investigators, so they've clearly put that in the report and outlined that in the recommendation. and that it would be nice to have some better laboratory support, whether it's at the national level of the Comoros or whether it's at the level of the region in Madagascar. Thank you very much, Saindou. It was really nice. We're really happy to have the Indian Ocean FETP presenting such high-quality field work at Escaide in Stockholm. Welcome. Come again.